In the mid-1980s, a group of pediatric therapists realized that they were missing a key element in their treatment of children and families. That element was the emerging knowledge of infant social and emotional health. Parents would come in and drop their babies off with a therapist, so the work was not being done within the family relationship. The pediatric group decided to work within the family relationship and began seeing the parent and the baby as one unit. The outcome was healthier and happier babies. At this point, Texas Association for Infant Mental Health, or TAME, was formed to study best practices and promote working with children in the context of a family relationship. TAME's vision is for all Texas babies to experience nurturing relationships within the context of family and community. Babies grow and develop through healthy relationships in everyday life with important people in their lives. Playing, bath time, feeding, cuddling, talking, singing are all everyday moments that nourish the baby's growing brain. TAME is working to educate those who touch the lives of babies. Parents, legislators, judges, Child Protective Service staff, child care workers, nurses, social workers, early childhood specialists, and others. Our goal is to equip them with the most current knowledge about how babies grow and learn, and how their interactions with the babies affect their developing brain. We believe this knowledge should be reflected in public policy. For example, Texas does not require child care ratios that are recommended by the American Academy of Pediatrics. They recommend one caregiver for 3 babies, while Texas allows one caregiver to care for 4 babies, and actually 2 caregivers can care for 10 babies. Texas also does not fund enough child care places to meet the demand of the working poor. So there's a long list for people waiting for quality child care. We need to build a collaboration between scientists and policymakers and businesses and parents and professionals to create a plan. Then, with the knowledge we have about babies' mental health needs, advocate for innovative and effective policies at the state level that will improve the lives of all Texas babies starting at birth. TAME is the only nonprofit organization in Texas that focuses on the social and emotional health of babies. We are uniquely positioned to take current research to those who care for babies. We have a 24-hour curriculum that covers most of the key concepts like brain development, attachment, temperament, the importance of play, sensory integration. This curriculum is being used by our trainers in Houston for classes of child care providers and Child Protective Service staff. The curriculum also covers most of the components in the TAME's endorsement for culturally sensitive, relationship-focused practices promoting infant mental health. This endorsement process has been adopted by 15 other state infant mental health associations, and TAME was the first in the nation to adopt it. Endorsement is a process of demonstrating an individual's infant mental health knowledge and becoming part of a professional group that requires annual continuing education. As a small organization, TAME depends on its staff to achieve its objectives of securing a funding base, chapter development, increasing the number of caregivers trained, increasing public awareness of infant mental health, moving from an operating board to a governance board, and improving the website. TAME staff and board really drive the organization to be effective and are a voice for babies at the local and state level. Everyone at TAME is driven by a passion for the welfare of babies. The strategic plan has set out certain goals, such as the number of TAME members, new chapters established, the number of trainings conducted, the number of individuals endorsed, the number of educational opportunities presented, like Food for Thought at KERA Dallas, and the Brazelton Advocacy Award and Conference, and, of course, the number of grants and gifts secured. It is amazing how many people do not know that a baby begins to learn at birth and that their environment matters greatly to their future success in life. It matters if they are read to, talked to, played with in caring relationships, as relationships build the structure of the brain. Quality child care and parent education helps level the playing field for children who live in poverty or near poverty. Dr. Heckman, the Nobel Prize laureate in economics, argues for investment in early education to build a stronger America. Science has shown us that a baby's brain learns from other brains. Just making the most of everyday moments like bath time, talking, and playing is helping the brain develop. The human brain grows the fastest from birth to 3 years old, more than at any other time in life. We can make up some deficits, but it's much more difficult in later years. We've built our membership across the state over the past 3 years to 400 strong. We've developed infant mental health chapters in Houston and San Antonio, bringing the number of chapters up to 6. For the past 12 years, we've held a well-attended and respected biannual Brazelton Infant Mental Health Award and Advocacy Conference. We've successfully worked on legislation requiring 24 hours of initial and annual training for those working in child care. This is up from the previous only 8-hour requirement. We've grown the numbers of professionals participating in endorsement to 261. And finally, we've been recognized by major foundations through their support. As with so many nonprofits, the challenge has been securing financial support to keep the organization staffed and running. About 5 years ago, 2 very generous Dallas families gave TAME $400,000 to support the hiring of an executive director and an administrative assistant. The last of these funds were expended in 2011, so the challenge has been to build support from individuals, foundations, and membership to support the budget. We have some funds in reserve, but we will need to raise our annual budget in a timely manner moving forward. TAME also needs to diversify the funding support to include more individuals and businesses as well as revenue-generating products. Presently, we are working with Dallas Social Venture Partners to explore taking our curriculum to web-based delivery. We have talked with a few educational web platform operators and are exploring putting our curriculum on a web platform so that the training material is accessible to caregivers in rural areas. The cost of this is several $1,000s. Our website is adequate, but could do so much more if we had a staff person dedicated to uploading current information to educate parents, caregivers, and anyone working with babies. This person could serve as our public relations and marketing director, with web maintenance being just a part of their job. If funded, TAME would provide training to more Child Protective Services staff. We are currently training 30 CPS staff in Houston through a Hogg Foundation grant. 41% of the children in the CPS system are 3 and under. The evaluations speak loud and clear to the need to bring current research and knowledge to the staff that is working with babies. There is a huge gap in the public's education about the needs of babies. We are presently working with Avance Dallas to bring knowledge of babies and how they learn to Avance Promotoras, moms that work in the community. These moms are learning how important everyday moments are and what can and should be done to help their baby reach its full potential. In turn, they take this information to the moms and dads in their communities, their neighbors. We would like to reach out to grocery stores, airlines, and other businesses to promote the message of better baby care. The state of Washington has built a collaboration to work towards applying the science of early childhood development to state policy and practice. TAME could serve as the initiator of such a collaborative effort in Texas.